Chapter 7, Skeletal System, Bone Structure and Function, Chapter 4. So, we were talking about hormones and affecting bones. Well, we also know that there are hormones that affect calcium levels in the bloodstream. And the overall consequence of this is it ends up affecting the activities of osteoblasts and osteoclasts, since our excess calcium is stored in the bone tissue. So as we mentioned before, calcium is extremely important for the body. It helps to initiate muscle contractions, including the heart itself. It is important in the exocytosis of molecules, neurotransmitters from cells, including neurons. So for neurons, it's neurotransmitters. It stimulates the activity of the heart's pacemakers, and it is involved in blood clotting. So calcium is extremely important. The amount of calcium in the body is affected to some degree by having the proper amount of vitamin D. Vitamin D is a weird vitamin because it's also kind of a hormone. So in our bodies, our liver produces this precursor molecule, 7-dehydrocholesterol. You don't have to remember its name, but it goes into the skin, and then it is affected by UV light, becoming what we know as vitamin D. Vitamin D is a compound based on cholesterol formed in the skin, or of course we can get it from the foods we eat, taking supplements, drinking milk. Vitamin D then goes to the liver where it's converted into calcidiol, which is still a precursor, and calcidiol will then go to the kidneys where they will be converted into calcitriol, which is the active hormone. And then, when needed, calcitriol will be released and sent to the small intestine to increase the absorption of calcium from the foods we consume. So vitamin D is a crazy, crazy substance that goes through many, many stages in many parts of the body, all to make sure we get enough calcium from the foods we eat. All right, parathyroid hormone. Parathyroid hormone, surprise, surprise, secreted by parathyroid glands. It is secreted in response to reduced blood calcium levels. So when there are low concentrations of calcium in the blood, the parathyroid gland secretes the parathyroid hormone. Parathyroid hormone, also at the same time, citriol from the kidneys is being secreted as well. So we have both parathyroid hormone and calcitriol being secreted. Turns out they work together sort of synergistically in raising calcium levels. So calcium levels too low, secrete parathyroid hormone and calcitriol to raise the calcium levels in the bloodstream. Basically, the way they work is they elevate blood calcium levels in order to return it to its normal natural homeostatic range. And then when enough calcium is being produced and is found in the blood, so the blood's calcium levels have increased sufficiently, then this acts as a negative feedback. So calcium levels increase to ideal levels. This will then inhibit the release of parathyroid hormone and calcitriol. So what do these hormones actually do? Well, to start with, like I said, they work sort of synergistically together. They will increase the activity of osteoclasts in bone tissue. So this will increase the breakdown of the bony matrix, causing more calcium to be released into the bloodstream, helping to increase the levels of calcium in the bloodstream. They also affect the kidneys, causing the kidneys to decrease the amount of calcium that is lost in urine. So more calcium is being reabsorbed from the urine that's being produced back into the bloodstream, and less of it is being secreted in our urine. So overall, it helps to keep the calcium levels higher. And then calcitriol by itself, of course, goes to the small intestine and increases the absorption of calcium from the foods we eat. So we get more calcium from what we eat, we get more calcium from the bones, and we lose less calcium from the kidneys. All right, moving on to calcitonin. This is a new hormone, calcitonin, produced by the thyroid gland. Calcitonin also helps to regulate blood calcium levels. Basically, it is released in response to high calcium levels. We do not want the calcium levels in the blood to get too high. So calcium levels in the blood get really high, stimulates the thyroid gland to release calcitonin. Calcitonin then goes to the bones and inhibits the osteoclasts. So inhibits the osteoclasts, less bone tissue is being broken down, so there's less less calcium being released into the bloodstream. Also, the calcitonin goes to the kidneys and increases the loss of calcium in the urine. So more calcium ions are being secreted by the kidneys. So net effect is that we are losing calcium, lowering the calcium levels. And again, once the calcium levels return to normal, this will act as a negative feedback and tell the thyroid gland to stop producing calcitonin. All right, aging. Aging affects bones in two big ways. First of all, there's a decrease in overall protein synthesis by osteoblasts. So we're getting less of the organic material being deposited in the bones, less collagen fibers being produced. This will decrease the tensile strength of the bone, making it a bit easier to break. This will also mean that there'll have to be a little more inorganic material to kind of compensate for the overall mass of the bone. However, that only makes the bones harder. It does not make them stronger, so the bones will become brittle and more susceptible to fracture. However, we also have, as a person gets older, a loss of the inorganic material in the bone tissue. So bones become thinner and weaker because they're not able to deposit as much hydroxyapatite as used to. And this insufficient ossification that normally develops is known as osteopenia. So elderly people, sometimes older adults, will potentially develop osteopenia. So again, less organic material, less inorganic material, bones become weaker, which can lead to bone fractures. Anybody can get a bone fracture. It's just a little easier to get in elderly. So some different kinds of bone fractures. We have the compound fracture or open fracture. Here the bone breaks. It's rather single place where the fracture occurs, but a part of the bone sticks out from the skin so it actually can be seen and touched, versus a simple or closed fracture where you get the break but none of the bone's exposed to the surface. Then we have the comminuted fracture. In a comminuted fracture, the bone is shattered at the site of impact, leading to lots of small fragments. This usually requires a surgery to repair, to reposition the bone fragments. We have green stick fracture. A green stick fracture is where the bone is partially broken, but not fully, and the bone sort of bends, sort of like if you tried to break a green stick. This is more common in children because their bones tend to be a little more flexible and bendy than adults. We have the impacted fracture, where the end of one bone is jammed into the medullary cavity of the second part of that bone. We have the pot fracture. The pot fracture is very specifically a fracture of the distal end of the fibula. So you get a break in the distal end of the fibula, and often there's also some ligament damage on the medial side of the foot. There's the Coles fracture. The Coles fracture is when the distal end of the radius is broken, and then the parts of the radius actually overlap a bit. This is relatively common in when people catch themselves falling and break their radius. You can have a compression fracture where the bone is crushed. It doesn't actually become lots of separate pieces, but there are lots of fracture lines running throughout the bone. Pretty common in the more porous bones, so in osteoporotic bones of the elderly. Depressed fracture is when the bone of a flat bone sort of caves in. Often this is caused by some sort of impact that causes the depression. A little more complicated to heal. A spiral fracture is a fracture that runs up the length of the diaphysis and goes around the bone like a spiral. This is pretty common in sports injuries because it can happen when there's some sort of impact between people causing massive twisting forces on that bone. All right, well, we obviously want our bones to heal. So fracture healing, a simple fracture, simple, straightforward, single break, can take 2 to 3 months in the average adult. Compound fractures, other complicated fractures can take longer to heal. And of course, the healing process slows down with age. Bone repair comes in 4 stages. First, you have the fracture hematoma. So the damage occurs, impact happened, the bone is broken, breaking many blood vessels, and blood will form a large clot or hematoma in that area. So pretty much quickly, immediately after the bone fractured, there will be a swelling in the area of the fracture caused by the hematoma forming. Then, slowly over time, the hematoma will be replaced with fibrocartilage material. So you get a fibrocartilaginous callus, a soft callus forming in the area of the break. This then allows blood vessels to start to regrow and reform into that area and also helps to stabilize the ends of the bones. This takes a few weeks. From there, over time, the fibrocartilaginous callus gets replaced with a hard callus or bony callus made up of spongy bone material. So now we have spongy bone replacing the area where we had the fibrocartilaginous callus. Blood vessels can now fully be regrown and reincorporated. And then over time, the bone tissue will get remodeled into the appropriate arrangement we expect for that part of the bone, where, say, if it's along the diaphysis, you'll have the lovely medullary cavity, the compact bone tissue, and the periosteum. Again, this process can take 2 to 3 months to heal, longer in older adults. And that is it for this chapter.